The healthcare business is vast, from patient care and clinical outcomes to innovation and research. Clinicians here often help to advance medicine and enhance their expertise, all while continuing to provide patients access to the latest treatments and high-quality care. Well, let's head out to ProMedica Toledo Hospital and ProMedica Ebide Children's Hospital to hear from some of the innovative clinicians on some of the latest research studies that you may not know are occurring in our region. We'll talk with Dr. Syed Zedi and Dr. Richard Burgess, stroke neurologist and neurointerventionalist on the ProMedica stroke team. We'll also hear from Dr. Iman Hariri, an advanced heart failure cardiologist, and Dr. Jamie Dargett, a pediatric hematologist oncologist. Let's head out. I'm here at ProMedica Toledo Hospital talking with Dr. Hariri, who is an advanced heart failure cardiologist, and we're talking about research today. So, Dr. Hariri, great to be with you today.
Thank you, Christy, for having me. Appreciate you guys coming out here.
Glad to be here to hear more about your study. So I know that you're really involved in this research that's going to improve people's lives, specifically those who have had heart failure and perhaps can't get relief from medication. But I want you to tell us more.
Yeah, sure. You know, often patients think of studies for things like cancer treatments and chemotherapy, but we've really gotten to a point in our heart failure care locally where we're thinking outside the box for our patients, trying to make sure that they get the opportunities afforded elsewhere, right here at home. Especially in access to studies that are conducted at many of the elite centers around the country, and allowing them and affording them the opportunity to be enrolled in these studies here to get the first dibs at basically at treatments available for heart failure. Our study that we have now, that we've enrolled our first patient in, is a study for patients who have heart failure and are not getting the relief they should get with medications, and kind of thinking outside the box on new and emerging treatments, and creating something called a shunt inside the heart that helps relieve the symptoms of congestion and fluid overload that often a lot of patients with heart failure suffer from, and seeing how they do over time and reducing the symptoms burden, and also looking at their rates of hospitalizations and improvements in things like their 6-minute walk test and distance that they're able to achieve with that and their functional capacity overall.
So when you're talking about those who can get involved in your study, they would have those kinds of symptoms?
Yeah, so those are patients who are on classical treatments for heart failure, basically water pills or other medications for blood pressure and symptoms control, that are still getting symptoms of shortness of breath or hospitalized with heart failure, that are essentially looking for symptoms relief outside of what's available for them.
And through your study, obviously you are really pushing emerging technologies and impact for the future. Tell us more about that and how the outcomes will be impacted positively for those patients.
I think the innovation across the cardiac world has really propelled these therapies forward for patients, because every day with the use of technologies that we have out there is helping our patients get out of just using medications to treat their condition and getting fixed, whether it's for valvular heart disease, holes in the hearts, going away from things like open heart surgery to minimally invasive surgeries, or even surgeries or procedures that happen through going through their arteries and veins, essentially.
And I would imagine that this study is truly drawing people from across the region, but also across the country.
Yeah, so this is actually, the study we're part of is an international study. It involves a lot of centers around the world and in the country, led by people over at Tufts University in Boston and Duke University in North Carolina.
We thank you for your time today and for all of the research you're doing.
Yes, absolutely. Thank you. Thanks for coming on.
Thanks, Dr. Hariri.
All right,
We are here at ProMedica Ebide Children's Hospital with Dr. Jamie Dargett. She is a hematologist oncologist in pediatrics. Thanks for being with us.
Thank you.
So let's hear a little bit more. I know you've really been participating in an important clinical trial that is helping some of the pediatric hematology oncology patients to heal, to thrive, to have better treatment protocols. So tell us more about the study.
So the study is a part of a larger group called the Children's Oncology Group, or COG. This is over 200 pediatric cancer centers in North America, Australia, New Zealand. And it's smaller centers like ours working with larger centers, all with the goal of studying newer therapies, better therapies to improve outcomes in our children with cancer.
What is B-cell acute lymphoblastic leukemia, and tell us how the study is really working into that.
So B-cell acute lymphoblastic leukemia, or B-cell ALL, this is the most common type of cancer that we see in children and adolescents. It arises in the bone marrow, which is actually a liquidy part inside the bones where the body makes the blood cells. In children, that can present with bone pain. They might have enlarged liver or spleen, so they might have abdominal pain. If they become anemic or their red blood cell count is low, they can be more tired, pale, or dizzy. If their platelet count is low, these are the cells that help the blood clot. They can have nosebleeds or gum bleeds or more easy bruising. They can have fevers. There's a lot of different ways children can present with this.
In the world of childhood leukemia, there has been success, I have read, in terms of immunotherapy and using immunotherapy earlier in treatments to perhaps impact outcomes. Tell us more about that and how that ties then to your study.
So actually, childhood leukemia is one of the success stories in cancer therapy. Back in the 60s or 70s, children diagnosed with cancer almost universally died. And it was actually one of the first types of cancer in children or adults where we looked at using different types of chemotherapy to kill those cancer cells. So that if the cancer cells develop resistance to one type of chemotherapy, we're using multiple other kinds that kill the cells in different ways to overcome that resistance. And over the last 50, 60 years, pediatric leukemia survival went from less than 20% to 80, 90, even higher rates of survival. So it's truly an amazing success story. And we have built this on decades of research, of building on that, looking how we can both improve outcomes in terms of decreasing the risk of relapse, improving survival, but also decreasing the short-term and long-term side effects of treatment. So we are so grateful to our patients and families who participate in this research because they know and they understand it may or may not benefit their child, but it's definitely going to benefit children coming in the future.
And what is involved if a patient is coming into the study? What would that patient partake in?
Traditionally, chemotherapy is medications that kill cells that are dividing. And that's why we have so many side effects that I think so many people are familiar with. Hair loss, lower blood counts requiring transfusions. It suppresses the immune system, so higher risk of infections or serious infections, nausea, vomiting. So we have pretty much maxed out on how much we can do with conventional chemotherapy. And there are some newer classes of medications like blinatumomab, which was the focus of this clinical trial, that use the body's immune system to kill the cancer cells. So the study is looking at using it in the beginning, early on in treatment, in children newly diagnosed with B-cell ALL to see if it improved outcomes. The medication is challenging to give. It does have to go into an IV, and most of our patients have a special IV that can stay in for months or years. The medication, rather than just coming to clinic, getting a dose of the medication and going home, these children actually needed to receive the medication as a continuous infusion for 28 days at a time.
Tell us then about patient outcomes.
Within our community, it's a small community, but the outcomes of the study actually caused a lot of excitement because it really changed the standard of care for these patients. That it improved their overall, the risk of relapse decreased by about 8%, and overall that's about a 60% decrease in the rate of relapse in these children.
Dr. Dargett, thank you so much for all you're doing. We appreciate you being with us today.
Thank you.
I'm here with Dr. Syed Zedi. He is on the ProMedica stroke team and is a stroke neurologist. And Dr. Zedi, it's great to be with you.
Thank you so much.
You have done so much here at ProMedica, and the stroke team is really involved in research. So tell us more about one of the studies that you've been truly involved in.
One of the main procedures that I do as a stroke neurologist, neurointerventionalist, when someone comes to us with a stroke, is to try to retrieve a clot out from the brain. See, strokes happen when the blood supply to the brain is interrupted. So if a blood clot is plugging up a main artery in the brain, what we do is we either go to the wrist or to the groin, to the main arteries, into the brain using our catheters and devices, and our goal is to try to extract that clot out of the brain. Quite often we are very successful, thankfully, and it has shown that this procedure saves lives, it saves disability, it's very remarkable, very rewarding on our end. Unfortunately, there are times when, as we take the blood clot out of the brain, some small fragments of it are released or they're not caught properly, and they go downstream in the brain. They plug up like really, really small, tiny branches of the brain. And as you can imagine, all blood vessels in our brain, regardless of their size, they are important. So what to do with these tiny fragments of clots which are now lodged deep in the brain, right? So one of the things that we have at our disposal, which has been studied in cardiac world a lot, it's a medicine, it's called tenecteplase. It's a clot-busting medicine. So the thought that we had was, in the scenario where we are dealing with these residual small fragments of clots deep in the brain, which we can't go up and chase out and extract anymore, what about we use this drug sort of as like a Drano? So we did the very first study of its kind in the United States. We enrolled 20 consecutive patients who received this drug at a certain dose. And the idea was to begin with just show that it's safe and it's feasible, that it's doable. And we got very promising signal. So proud to say that was the first study in the United States, actually in the world, showing the safety of this medication. It was published earlier this year. And we are now embarking on a phase 2b/3 larger clinical trial. This is an area of very active investigation right now in our field.
Congratulations.
Thank you.
I mean, that's a big deal. And we talk about stroke patients all the time and the impact that neurologists can have on stroke patients. What can patients do to perhaps prevent a stroke? Or if they believe there are symptoms coming on, what should they be looking for?
Yeah, no, that's such an important question. Stroke patients, the time is of essence. Time is very critical. The sooner they can come to us, the better perhaps we can attend to them and try to reverse the symptoms of stroke. As I said, time is important. So knowing the stroke symptoms, it's very, very important. So one of the acronyms we use is BFAST, which basically stands for balance and vision, face, arm, speech. If there is any trouble in any of those domains, call 911. So if public at large is educated about the stroke symptom, that becomes very important. The other part, we are questioned what can be done to prevent a stroke. I think that's very important. Just taking care of yourself, right? We know that regular exercise and heart-healthy diet, I mean, those are traditional risk factors, and avoiding smoking, simple things like that.
And that stress thing, that's a big one. And
that
I
is
don't
a
know
big
how
one.
we handle that one.
Yeah, and it's such a good question there, because stress certainly has impact. We know that. It's just so hard to measure though, and everyone deals with stress differently, and in some cases it can have these morbid outcomes, both with heart attack and stroke.
We look forward to hearing more about the outcomes in your research studies, and thanks for being with us today.
Absolutely, thank you.
We appreciate the impact you're having on your patients as well.
Thank you for this opportunity.
I'm here on location with Dr. Richard Burgess, and we're talking about the ProMedica stroke team and some of the incredible research that's going on. So thanks so much for being with me.
It's great to be with you. Great to give an opportunity to talk about the amazing research that's going on at ProMedica and with the stroke team. I always appreciate the opportunity to sort of tell folks that are out there about some of the great things that we're doing and that are really advancing care for our patients and are both in the region and around the world.
Tell us more about some of the impactful research you're doing for stroke patients.
We do research into stroke, and stroke is about blood vessels in the brain. Sometimes they are clogged and we have to unclog them, and sometimes they leak and we have to plug them. And we're doing research into different ways to take care of all of that, both medications, novel devices, and so innovative ways to deal with that. As an example, over the years, at least even in my career, we've been only able to open up blood vessels with medications in the first 3 hours. Then it pushed out into 4.5 hours, and then out to a day, and went from medications to devices. And right now, with some of my colleagues, we're doing studies that look to try to open up those blood vessels beyond 24 hours with novel medications. And on the leaking side, people come to us, unfortunately, with brain aneurysms that have ruptured, leaking into the brain. And these are critically ill folks. And over the last 20 years during my career, there have been amazing advances in the devices that we have to treat those. But one of the great things about ProMedica is because we treat so many patients and because we work with so many of our partners around the country and around the world, that we get access to devices that other places don't. Stroke care has gotten so much better. It's gone from the third most significant cause of death in the United States to the fifth just during my career.
And when you talk about the goal for you with your stroke patients, what is that goal?
Typically it is to improve their outcomes. It is to, get them back to life. And there's so many patients now that would have been in a nursing home and their life would have been changed forever that now walk out of the hospital. And that's because of research that has been going on around the country, but right here at ProMedica as well. And that's been going on over the last 10 to 20 years, and we're only pushing forward even more.
Thank you for all you're doing, and thanks for being on Business Life 360.
Great to talk to you, thank you.
Thank you.